Have you ever looked around at friends your own age and wondered why some people in their 70s still walk with confidence, think clearly, sleep peacefully, and enjoy life, while others struggle with constant fatigue, pain, and declining independence? Many people believe aging itself is the reason, but modern medical science tells a very different story. Your body is constantly sending you messages. Long before a serious illness appears, your heart, brain, muscles, blood vessels, and immune system quietly leave clues. These clues are not random. They are measurable biological signals that doctors and researchers around the world have studied for decades. Today, we're going to explore 7 important signs that healthy older adults often have. If several of these signs are missing in your life after the age of 70, your body may not simply be getting old. It may be asking for help. The encouraging news is this: many of these changes are reversible, or at least greatly improvable. Your body has an incredible ability to adapt, even in your 70s, 80s, and beyond. Research from Harvard Medical School, the National Institute on Aging, and Stanford University consistently shows that healthy aging is influenced far more by daily habits than most people realize. Welcome to Dr. Mason Health, the wellness surgeon, where every discussion is built on medical evidence, trusted research, and practical advice designed to help you enjoy a stronger, healthier life. If you're ready, let's begin with the first sign. The first sign is that you can recover your energy after normal daily activities. Think about your average day. You prepare breakfast, you walk around the house, perhaps you visit the grocery store, spend time gardening, or play with your grandchildren. Feeling pleasantly tired afterward is perfectly normal. But if these ordinary activities leave you exhausted for hours or even the rest of the day, your body could be signaling something deeper. Many older adults assume this is simply what happens after 70. Yet a landmark study published in the Journals of Gerontology found that persistent fatigue in older adults is strongly associated with chronic inflammation, reduced muscle quality, cardiovascular disease, anemia, and declining metabolic health. Researchers at Yale University have described fatigue as one of the earliest indicators that multiple body systems are under stress. Your cells are producing less usable energy, even when you're eating enough food. Inside every cell are tiny structures called mitochondria. You can think of them as microscopic power plants. Their job is to convert nutrients into energy. As you age, mitochondria naturally become less efficient. However, inactivity, poor nutrition, uncontrolled diabetes, smoking, chronic stress, and inadequate sleep can accelerate this decline dramatically. A review published in Nature Reviews Molecular Cell Biology explains that damaged mitochondria produce more harmful molecules called reactive oxygen species. These molecules increase oxidative stress, damage surrounding cells, and reduce the body's ability to generate energy. This creates a cycle. Less energy leads to less movement. Less movement weakens muscles. Weaker muscles require even more effort to perform simple tasks, making you feel even more exhausted. Fortunately, studies from the University of Birmingham and the Mayo Clinic show that regular walking, resistance exercises, and adequate dietary protein can stimulate the production of healthier mitochondria, even in older adults. Protein becomes especially important after 70 because your muscles become less responsive to small amounts of protein, a phenomenon known as anabolic resistance. Research published in the American Journal of Clinical Nutrition suggests that many seniors benefit from consuming around 25 to 30 grams of high-quality protein per meal, depending on their overall health and guidance from their physician. Foods such as eggs, Greek yogurt, fish, chicken, beans, lentils, and cottage cheese provide essential amino acids that help preserve muscle tissue and improve recovery. Iron, vitamin B12, and vitamin D also deserve attention. According to the National Institutes of Health, deficiencies in these nutrients are surprisingly common among older adults and may contribute to weakness, fatigue, and reduced physical performance. If you constantly feel drained after activities that once seemed easy, don't dismiss it as normal aging. Your body may simply be asking for better fuel, stronger muscles, and healthier circulation. The second sign is that your walking speed remains steady and confident. Walking may seem too simple to tell us much about health, but doctors often call walking speed the 6th vital sign. That may sound surprising, yet decades of research support this idea. A large international study published in the Journal of the American Medical Association found that walking speed predicts overall survival remarkably well in adults over 65. Individuals who maintain a faster, stable walking pace generally have healthier hearts, stronger muscles, better brain function, and lower rates of hospitalization. Why is walking so informative? Because walking requires nearly every major system in your body to work together perfectly. Your brain must process balance information. Your eyes help guide your movements. Your inner ears detect changes in position. Your nerves send electrical signals. Your muscles generate force. Your joints absorb impact. Your lungs provide oxygen. Your heart pumps blood efficiently. If any one of these systems begins to fail, your walking often changes long before obvious disease develops. Researchers from the University of Pittsburgh found that even a slight reduction in walking speed can be associated with increased risks of cardiovascular disease, cognitive decline, and future disability. This doesn't mean walking slowly always indicates illness. Some people naturally walk at different speeds. The concern arises when your own usual pace becomes noticeably slower over several months without an obvious reason. One important cause is sarcopenia, the age-related loss of muscle mass and strength. According to the European Working Group on Sarcopenia in Older People, adults can lose approximately 3 to 8% of muscle mass each decade after age 30, with the rate accelerating after 60. Muscles are not simply for movement. They act as metabolic organs that regulate blood sugar, reduce inflammation, protect bones, and improve immune function. Research from Tufts University has demonstrated that maintaining muscle strength significantly lowers the risk of falls, fractures, and loss of independence. Balance also plays a crucial role. The vestibular system inside your inner ear continuously communicates with your brain to help you remain upright. Age-related changes in this system can make you feel less stable, particularly when turning quickly or walking on uneven ground. Studies from Johns Hopkins Medicine estimate that balance disorders affect millions of older adults and are a major contributor to falls, which remain one of the leading causes of injury after age 65. The encouraging part is that balance can improve. Tai Chi has been extensively studied by researchers at Oregon Research Institute and other medical centers. Multiple clinical trials have shown that regular Tai Chi practice significantly reduces fall risk by improving coordination, posture, and lower body strength. Simple exercises such as standing on one foot while holding onto a stable surface, heel-to-toe walking, chair squats, and regular walking programs can gradually strengthen the systems responsible for balance and mobility. Your walking pattern is more than a way of getting from one place to another. It is a living reflection of your cardiovascular health, nervous system, muscles, bones, and brain working together every single day. When your body allows you to move confidently and recover well, it is giving you one of the strongest signs of healthy aging. The third sign is that your mind remains clear, curious, and able to learn new things. Many people fear memory loss more than almost any other part of aging. Forgetting where you placed your reading glasses once in a while is common. Walking into a room and briefly forgetting why you went there can happen at any age. But if you frequently struggle to follow conversations, lose track of familiar tasks, or notice that your thinking has become consistently slower, your brain may be signaling that it needs attention. The encouraging news is that your brain is far more adaptable than scientists once believed. For decades, researchers assumed that the aging brain simply lost neurons and gradually declined. Today, evidence from Harvard Medical School, University College London, and the National Institute on Aging paints a much more hopeful picture. Although aging does bring natural changes, the brain continues to form new connections throughout life through a process called neuroplasticity. Every time you solve a problem, learn a new hobby, practice a language, play a musical instrument, or even take a different walking route, your brain strengthens communication between nerve cells. A landmark study published in the Lancet Commission estimated that a substantial proportion of dementia cases may be delayed or even prevented by addressing modifiable lifestyle factors. These include physical inactivity, high blood pressure, diabetes, smoking, hearing loss, social isolation, depression, obesity, excessive alcohol intake, and poor sleep. Notice something important here. Many of these factors are not directly inside the brain. They begin elsewhere in the body. Your brain consumes about 20% of your body's oxygen, despite making up only about 2% of your body weight. That means healthy blood vessels are essential. If blood flow is reduced by clogged arteries, uncontrolled hypertension, or diabetes, brain cells receive less oxygen and fewer nutrients. Researchers at the University of California, San Francisco have shown that tiny injuries to small blood vessels can quietly accumulate over years, increasing the risk of vascular cognitive impairment. Inflammation also plays a major role. Scientists from Stanford University have found that chronic low-grade inflammation may interfere with communication between neurons, making memory formation less efficient. Inflammation can also activate immune cells inside the brain called microglia. While these cells normally protect the brain, excessive activation over long periods may contribute to age-related cognitive decline. Nutrition becomes especially important here. The Mediterranean dietary pattern has been one of the most extensively studied eating patterns in the world. Research from the PREDIMED trial in Spain demonstrated that older adults following a Mediterranean-style diet rich in olive oil, vegetables, fruits, legumes, whole grains, fish, and nuts experienced better cognitive outcomes and lower cardiovascular risk. Omega-3 fatty acids found in salmon, sardines, trout, and mackerel help maintain the structure of brain cell membranes. According to research published in Neurology, individuals with higher blood levels of omega-3 fats often show slower rates of brain aging. Leafy green vegetables provide folate, vitamin K, lutein, and nitrates that support healthy blood flow and neuronal function. A study from Rush University Medical Center found that people who regularly consumed leafy greens appeared to have cognitive abilities similar to individuals many years younger than their actual age. Sleep is another pillar of brain health. During deep sleep, your brain activates a remarkable cleaning process called the glymphatic system. Researchers at the University of Rochester discovered that this system helps remove waste proteins, including beta amyloid, which has been linked to Alzheimer's disease. If you consistently sleep poorly, this cleaning system becomes less effective. That is why chronic insomnia is associated with increased risks of memory decline, depression, heart disease, and weakened immunity. If your mind still enjoys reading, learning, remembering names, planning your day, and participating in meaningful conversations, your brain is giving you an encouraging sign that many protective systems are working together. The fourth sign is that you maintain strong grip strength and functional muscle power. At first glance, grip strength may seem unrelated to longevity, yet physicians around the world increasingly use a simple hand dynamometer to estimate overall health. Why? Because grip strength reflects much more than the muscles in your hand. A major review published in the BMJ found that lower grip strength is associated with higher risks of heart disease, stroke, hospitalization, disability, and premature death. Researchers from McMaster University have also shown that muscle strength predicts healthy aging more accurately than muscle size alone. This matters because muscle tissue acts like a reservoir for amino acids, supports glucose regulation, stabilizes joints, and helps maintain metabolic health. As people age, they naturally experience anabolic resistance, meaning muscles respond less efficiently to protein and exercise. Without regular stimulation, muscle fibers shrink, especially the fast twitch fibers responsible for preventing falls and reacting quickly when you lose balance. That is one reason why falls become more dangerous with age. According to the Centers for Disease Control and Prevention, millions of older adults experience falls each year, and many of these incidents lead to fractures, loss of independence, or prolonged hospital stays. Fortunately, resistance training remains effective even in advanced age. Research from the University of Sydney and the American College of Sports Medicine consistently shows that adults in their 70s, 80s, and even 90s can significantly increase muscle strength through properly supervised resistance exercise. Simple movements such as standing up from a chair repeatedly, carrying grocery bags safely, climbing stairs, or using resistance bands all challenge the muscles enough to encourage adaptation. Protein intake again becomes essential. Leucine, one of the branched-chain amino acids found in dairy products, eggs, fish, poultry, soy, and lean meats, activates an important cellular pathway called mTOR, which stimulates muscle protein synthesis. Clinical studies published in the Journal of Nutrition indicate that combining resistance exercise with sufficient protein produces far greater improvements in strength than either strategy alone. Vitamin D also contributes to muscle performance. According to research from the Endocrine Society, vitamin D receptors are present within muscle tissue. Deficiency may contribute to weakness, slower walking speed, impaired balance, and increased fall risk. Since older skin produces less vitamin D from sunlight, many seniors should discuss testing and supplementation with their healthcare provider. Magnesium deserves attention as well. This mineral supports hundreds of enzymatic reactions involved in muscle contraction, nerve signaling, and energy production. Researchers have found that inadequate magnesium intake is associated with poorer physical performance among older adults. Strong muscles are not about appearance. They allow you to open jars, carry laundry, rise from a chair without assistance, protect your joints, maintain healthy blood sugar, and preserve the independence that becomes increasingly valuable with every passing year. If your grip remains firm, your legs remain dependable, and your everyday movements still feel controlled rather than exhausting, your body is demonstrating one of the clearest signs of resilient aging. The fifth sign is that you sleep deeply and wake up feeling reasonably refreshed most mornings. Sleep is often treated as a luxury, especially after retirement, but from a medical perspective, it is one of the most powerful forms of biological maintenance your body performs. While you sleep, your brain organizes memories, your immune system releases protective proteins, damaged tissues begin repairing themselves, hormones are carefully regulated, and your cardiovascular system receives an opportunity to recover from the demands of the day. If you regularly fall asleep, stay asleep most of the night, and wake up with enough energy to begin your day, your body is sending a reassuring signal that many internal systems are functioning well. On the other hand, frequent insomnia, waking multiple times every night, loud snoring accompanied by daytime fatigue, or needing several naps simply to make it through the day should never be dismissed as just getting older. According to the American Academy of Sleep Medicine, chronic sleep deprivation is associated with higher risks of high blood pressure, type 2 diabetes, depression, obesity, stroke, and cognitive decline. Researchers at Harvard Medical School have also demonstrated that poor sleep disrupts hormone regulation, increasing cortisol, the body's primary stress hormone. Persistently elevated cortisol contributes to inflammation, weakens immunity, raises blood sugar, and accelerates muscle loss. Sleep also plays an important role in heart health. A long-term study published in the European Heart Journal found that individuals with consistent, high-quality sleep had a significantly lower risk of cardiovascular disease compared with those experiencing chronic sleep disturbances. Simple habits can make a meaningful difference. Keeping a regular bedtime, limiting caffeine late in the day, reducing bright screen exposure before bed, maintaining a cool and quiet bedroom, and engaging in light physical activity during the day all support healthier sleep cycles. If loud snoring, pauses in breathing, or severe daytime sleepiness are present, discussing the possibility of sleep apnea with your physician is especially important because untreated sleep apnea increases the risk of heart disease and stroke. The sixth sign is that your blood pressure, blood sugar, and waist size remain reasonably well controlled. Many serious diseases develop quietly. High blood pressure is often called the silent killer because it may damage blood vessels for years before symptoms appear. Elevated blood sugar can slowly injure nerves, kidneys, eyes, and the heart without causing obvious discomfort in the early stages. That is why routine health measurements are so valuable. According to the American Heart Association, maintaining healthy blood pressure dramatically lowers the risk of stroke, heart attack, kidney disease, and heart failure. Likewise, research from the American Diabetes Association shows that controlling blood glucose reduces complications affecting nearly every major organ. Excess fat stored around the abdomen deserves special attention. Unlike fat stored beneath the skin, abdominal visceral fat surrounds internal organs and behaves like an active endocrine organ. Researchers from the Cleveland Clinic explain that visceral fat releases inflammatory chemicals that increase insulin resistance, promote atherosclerosis, and raise the risk of metabolic syndrome. This helps explain why two people can weigh the same, yet have very different levels of health depending on where body fat is stored. Healthy eating patterns remain one of the strongest protective factors. The DASH diet, originally developed through research supported by the National Institutes of Health, has consistently been shown to reduce blood pressure. This eating pattern emphasizes vegetables, fruits, whole grains, beans, nuts, low-fat dairy, and lean sources of protein, while limiting excess sodium, highly processed foods, and added sugars. Fiber deserves particular recognition. Soluble fiber found in oats, beans, lentils, apples, and barley slows glucose absorption, supports beneficial gut bacteria, and helps lower LDL cholesterol. According to studies published in the New England Journal of Medicine, increasing dietary fiber is associated with lower cardiovascular risk and improved metabolic health. Regular movement is equally powerful. The World Health Organization recommends that older adults remain physically active throughout the week, combining aerobic activity, muscle-strengthening exercises, and balance training whenever possible. Even 30 minutes of brisk walking on most days can improve insulin sensitivity, lower blood pressure, enhance circulation, and reduce inflammation. The goal is not perfection, it is consistency. Small improvements maintained over months and years often produce far greater benefits than short periods of extreme effort followed by inactivity. The seventh and perhaps most meaningful sign is that you remain socially connected, emotionally resilient, and purposeful. Medicine has traditionally focused on blood tests, X-rays, medications, and surgery. Yet modern research increasingly recognizes that meaningful relationships and emotional well-being influence physical health in measurable ways. A landmark study from Harvard University, known as the Harvard Study of Adult Development, has followed participants for more than 80 years. One of its clearest conclusions is that strong relationships are among the greatest predictors of healthy aging, life satisfaction, and longevity. People who remain connected to family, friends, neighbors, community groups, or volunteer activities generally experience lower rates of depression, cognitive decline, and premature mortality. Why does this happen? Positive social interaction reduces chronic stress. Lower stress means lower cortisol levels, healthier immune function, improved cardiovascular health, and better sleep quality. Conversely, prolonged loneliness has been linked to increased inflammation and poorer health outcomes. Research published by the National Academies of Sciences, Engineering, and Medicine reports that social isolation increases the risk of dementia, heart disease, anxiety, and depression among older adults. Purpose also matters. Whether you care for a garden, mentor younger generations, participate in faith communities, volunteer, create art, read, learn, or simply look forward to spending time with loved ones, having a reason to begin each morning supports both mental and physical health. Scientists from the University of Michigan have found that individuals with a stronger sense of purpose often demonstrate healthier behaviors, lower rates of disability, and improved longevity. As you reflect on these 7 signs, remember that they are not a test you either pass or fail. Perhaps your energy is lower than it once was. Perhaps your walking has slowed. Maybe your sleep has become lighter, or your grip is not as strong as it used to be. These are not reasons to lose hope. They are invitations to act. Your body is remarkably adaptable. Scientific evidence repeatedly shows that better nutrition, regular strength training, daily walking, quality sleep, social connection, appropriate medical care, and consistent preventive habits can improve health at virtually every age. You are not trying to become 30 again. You are giving your 70-year-old, 80-year-old, or even 90-year-old body the best possible chance to remain independent, capable, and full of life. If today's discussion encouraged you, begin with just one change this week. Add one nutritious meal. Take one extra walk. Perform a few minutes of strength exercises. Schedule the health checkup you have been postponing. Call someone you care about. Small actions, repeated consistently, create extraordinary results over time. Thank you for spending this time with Dr. Mason Health, the wellness surgeon. If you found this evidence-based discussion helpful, please subscribe to the channel, give this video a like, and share it with a friend or family member who deserves to enjoy healthier aging. Your support helps us continue bringing trusted medical research and practical wellness guidance to people who need it most. May your days be filled with strength in your body, clarity in your mind, peace in your heart, and many healthy years surrounded by the people you love. Take good care of yourself, and remember that every positive choice you make today is an investment in your future health.